I'm a midwife, and today is our first lecture, and we are handling health service management and administration. Basically, we have to start with knowing what a hospital is, because when you look at what we are handling, the module is basically health service management. And health, you can't find it anywhere, but you find it in the hospital. So we need to understand what a hospital is, and that is our first topic for today. And as we continue, I just want us to define what a hospital is. And basically, a hospital is an integral part of a medical organization that provides comprehensive health care, both curative and preventive, and also reaching out to the community and serving as a center for education and research. So when you look at this definition, it basically tells us that a hospital is not just something that serves only one aspect, but it serves a lot of things. So meaning that we have to provide health care in a form of curative, and curative is basically providing either drugs, medicines that help our patients to cure. Then preventive, we basically prevent outbreak of either conditions, and we also prevent infections to our patients. And reaching out to the community, we reach the communities basically to provide health care. We go and give health talks to our communities in relation to conditions that we think can affect our community. When you look at the education, we actually provide services that help our students, the medical students, to learn from our hospitals. That's why we bring them for practice from different schools. They come and learn, and the staffs who are skilled train them from our hospitals. And also, a hospital is the area for research. And research actually is a way of finding out what we do not know, and finding out what we know and why it is the way we think it is. So research can also be carried in hospitals, which is very important for us to improve on the health care that we provide to our patients. According to Stigman's definition, it says a hospital is an institution for the care, cure, and treatment of the sick and wounded, as well as a place for medical study and training, which is not very far from the first definition. As you see the keywords: care, cure, treatment of the sick and wounded. Wounded is like having an injury. If a patient is injured and wounded, it can be either a gunshot, a stab, or just a fracture due to an accident. So let's look at the philosophy of the hospital. Philosophy is like a theory or a thought, whereby each hospital has its own theory or a thought on how they provide healthcare services. So a hospital's philosophy is just a guiding set of values and beliefs that steer its actions and decisions. So without a philosophy or a belief or a theory of a hospital, then there will be nothing guiding them in the way they provide their services. So there can be values that a hospital believes in, and they are able to provide the health care in relation to that, and they are able to make their own decisions on how they are supposed to provide their services to their clients. A hospital's philosophy is also a moral compass, defining its purpose and directing its path. So, since we said it's values and beliefs that help to steer its actions, then it also helps to define the purpose and directing the path. A path is basically what they follow, and it's more of guiding the healthcare provision within the hospital, and helps to shape how the hospital serves its community. So without this, then the hospital may lose its direction and its values. So it is very important for different hospitals to have their values and beliefs on how they are offering services, because can guide them, and they'll be able to meet the purpose of the hospitals. And then hospital authorities beliefs. This is whereby the authorities of the hospital have to have a belief in what they are actually aiming at. So believes in providing the highest quality of care to all, regardless of the background. When you look at healthcare services, everyone is destined to have a quality healthcare or a quality service from our hospitals. Therefore, regardless of who the person is, what he is, and his background does not hinder someone from getting a service. And that's what most of the authorities in different hospitals believe. Authorities like having power. So when you have authority over something, you also have power over something. So this is one of the beliefs that they have, that they should provide the highest quality of care to all, regardless of the background. So nobody should be prevented, or nobody should be denied to receive the best quality of care. Also, the hospital authorities believes commits to maintaining high standards of patient care in all aspects. Every kind of service that is provided in regards to the patient's care should be of a high standard, because if you don't meet the standards, that means you're not able to provide and actually meet the needs of your patient or your client. So the hospital authorities have to commit in maintaining the high standards of patient care in all aspects of services that they offer. And they have to embrace the dynamics educational setting and support training programs. When you look at the first definitions that we had, we talked about education, we talked about training. So every hospital has at least to have an aspect of education where we teach our students. They have to support the training programs that come in, um, maybe to the staffs. So they have to support so that we get skilled to provide the quality care to our clients. We also believe to advocate for research to advance medical and nursing services. As we mentioned in the definitions, that research helps us to actually improve on the quality of care that we give to our patients. So research is very important. So all hospitals in different capacities should encourage and advance in their research so that they can be able to improve the medical and nursing services, which are really of quality. And we also take a leadership role in the community, because we basically go and health educate our communities. And when you're not a leader, then there is nothing you can manage to implement in the community. So when you go to the community, you have to execute the leadership skills so that you can be able to be trusted by the community. What you're going to tell them, they will trust you and they will accept the teachings, the health education, the guidance that you're going to provide to them. And in that way, you're able to prevent the outbreak of diseases and so forth in the community. So these beliefs guide the hospital's actions and decisions, ensuring a commitment to excellence in health. So when the hospital adheres to these beliefs, then they will be able to actually make the right decisions. And through those right decisions, they'll be able to make the excellent services that they provide to their clients. And as we mentioned about the beliefs, we also know there should be objectives. In every organization, there is an objective. So different hospitals have different objectives on how they intend to provide the healthcare services to their clients. So they have to provide optimum health care to all, irrespective of the background. That is an objective that most hospitals, I believe, adapted, because they know everyone has a right to health. So irrespective of the background, having mentioned from the first slide, in our definition, it is a very clear objective that every hospital has to adhere to, because everyone is to receive uh, adequate and quality healthcare. Another objective is to offer care, cure, and preventive services for all. In each and every hospital, we have all these components whereby they are able to offer services that cure, services that prevent, and also they care, and that is more on the nursing um, uh, services. They provide a lot of nursing care to our clients, to our patients, and on the side of offering the care, looking at the nursing care, they really try to see that the patient feels is loved, and because of that warm welcome and that good attitude, our patients can really be able to pick up, and even the drugs we give to them to cure, they will be able to actually cure, and so many things can happen within this aspect of cure, care, and prevention. We also protect human rights during care. Every hospital has to look at human rights, which is very, very important. We have to protect human rights in different ways. The services we offer should look at the human rights. We have to make sure that we don't destroy life, but we promote life. So human rights is one of the most important thing in health, because we need everyone to receive what he expects to receive as a human being. So we have to protect their rights in all aspects of the services that we provide in our hospitals. Another objective is to provide training for healthcare professionals. And when you look at the definitions, as I still refer to, we talk about providing trainings. And the trainings are basically for the students, the nursing students, the midwifery students, the medical students, the pharmacy students, the lab technicians, and so forth. Because we provide these services, our students are able to be skilled, because in the hospitals we have the skilled professionals that will be able to transfer the knowledge that they have to our students. So in the hospitals, we look at improving the skills of our students, and engage in research for medical advancement is also a very important objective that every hospital is actually encouraged to adopt, so that we can be able to improve our services, we can be able to advance in our healthcare. And assuming a leadership role in the community, having mentioned that we move to the communities, we go and teach people in the community, we go and health educate them, we go and interact with them and do so many things in relation to health in our community. So we have to assume that leadership role so that they can be able to trust us. And when you look at the qualities of a health provider, leadership is one of being a leader is one of the qualities. So the leadership roles is very important for us in our communities. What is the scope of the hospital? And what do you understand by a scope? A scope is basically what the hospital is supposed um, to capture within its capacity, what it's able to handle within its capacity. And when you look at the hospital, not every hospital is the same. We have different levels of hospitals. So the scope of hospitals may vary according to their levels, and in this slide we want to speak about different scopes, but this will vary according to the levels as I've mentioned. So team approach to patient care is very important. When you're providing services to our patients, we have to encourage teamwork. one person cannot handle if it is an emergency. So we need to promote teamwork, and when there is teamwork, we are able to actually improve the health of our patients. We are able to improve on the quality of services that we offer. We are able to make the right decisions. So teamwork and team approach to the care of our patients is very, very important. And within our teams, we can be able to have different disciplines. We can be able to work with a doctor, work with a lab technician, work with a pharmacist, work with a social worker, and in that we are able to handle all aspects in relation to the condition of our patient, and there they will be satisfied with what we offer to them. A spectrum of healthcare services, a spectrum of the healthcare services basically looks at what we provide. What kind of healthcare services do we provide? How much of the healthcare services do we provide to our clients? So this will depend on the level and the capacity that the hospital is able to handle. And coordinated efforts among agencies. There are different agencies that support our hospitals, and their efforts actually matter in the scope of the hospital. So when there is a good coordination and very importantly, I want to say that cooperation, communication, and then understanding within these agencies can be able to help us manage what we are to manage within the different levels of the hospitals. And also the types of the agencies and their aims matter, because we can have different agencies and they have maybe what is not really necessary for the hospital, and that one can even affect the services that we provide. But if they are coordinating well and their efforts are directed in the management of the patients, their efforts are directed in the objectives of the hospital, then there we shall be able to actually address most of the issues concerning our patients. Then continuity of patient care. The continuity of the patient care is very important because as I've mentioned about the different levels of the hospital, if the hospital is in a lower level, and they are not able to handle the condition of the patient, that means they have to either refer this patient to another level so that the services can continue, the care can continue. But in case they are able to do it within their scope, then there should be continuity of health care to be provided to this patient so that he gets the complete services that he really needs for the condition that he has. Then integration of ambulatory and non-ambulatory care. We realize that ambulatory means our patients who are able to move, and the services that we give to the patients who are able to walk in and out of the hospital. And the non-ambulatory care are basically for the patients that are not able to move in and out of the hospital. So all these services are supposed to be provided within the hospital for those who are able to come in and those who are not able to move. So that's why we have the wards where we admit them for those who are not able to move and those who are not able to do anything for themselves. We provide them the areas where we take care of them, and those who are able to move and come back in and out, depending on the condition of the patient and what is suffering from, then we are able to give them the outpatient care. They go and come back when appointment is given. Periodic evaluation and research. We need to evaluate what we provide to our patients. We need to evaluate our services. We need to evaluate different areas of our care and our activities and different things that we do in our hospital. We need to evaluate so that we can be able to actually identify our gaps and be able to address them. and research is very important for every hospital, and the types of research and the levels of research also differ according to the level of the hospital and the capacity to handle the different kinds of research. Functions of the hospital. Having talked about the definitions and also having mentioned about the scope and the rest, you can be able to pick some of the functions of the hospital within even the definition of the hospital. So when you look at basically the hospital and its functions, it addresses a number of things. One of them is to provide client care for the sick and the injured. So a hospital should be able to provide care to the sick and the injured. If there is a hospital and they cannot be able to provide these services to the sick people and the injured, then it ceases actually to be a hospital. Another function is diagnosis and treatment services. When you look at diagnosis, these are different services that are actually carried out to help us come up with the disease or the condition of the patient. So the hospital should be having the capacity to diagnose the different conditions that our patients come in with and provide the treatment after the diagnosis. And outpatient services with various specialties. Outpatient services can be outpatient clinics, whereby they come with different conditions and we have different clinics as our outpatient services. So what I mean outpatient clinics, it can be a surgical clinic for outpatients. They just come for review. If they got an accident, someone got a fracture, broke his leg, and was treated, went home, he can be given an appointment to be seen in the outpatient clinic. So they provide outpatient services, not in the ward. And then the various specialties, these are people who provide those outpatient services because they have special skills that can handle those outpatient services. For example, another one is gynecological condition, basically looking at the women. Most of them can come with complaints of maybe someone has taken time without giving birth, someone has abnormal pain in the abdomen and she wants to know what is the cause. We don't admit them, but we basically see them in the outpatient clinic. So they provide them outpatient services, and these are specialists who are called obstetricians and gynecologists. Um, the other function is medical and nursing education. So medical and nursing education, as we talked about training our students, the nurses, the doctors, the midwives, and the rest of the team. So the hospital has a function to actually provide those services to our students. And as we do this, we are improving their skills. We are teaching them, besides what they have learned from class, they also come and try to bring those skills out. Because in class we do the theory, in the hospital we should be able to do the practical bit of it. And when they come to the hospital, it is really the initiative of the health workers in the hospital to really teach these skills to our students. And that's why it's also a very good function that hospitals have to adopt. And these students should be taken like colleagues. Most of the time, the qualified staffs teach the students, but they don't really take that as serious initiative to really help them know what they're supposed to do. And yet, actually, they are the ones who are to succeed them in the next future. And some of them end up landing in the hands of these students, and yet you didn't really support them to know what to do at the time when you were still practicing. So in the hospital, when they come, they are really supposed to be supported and directed, guided, and taught to understand some of these skills and how they are supposed to handle the patients. And we shall also be able to improve our healthcare and our relationship with the patients when we who are in the hospital are able to actually show that attitude of love when we have the students with us. Research opportunities is also one of the most important function of the hospital. We have very many gaps. We have very many opportunities in which we can advance in research. So the hospital has a role to play in research because we have patients who come with different conditions which we may not be able to understand. But when we do research, we can be able to identify some of these conditions and shall be able to also know how to manage them. So research is very important as one of the key functions of the hospital. Then preventive care and health promotion. In the hospitals, we give health talks. In the hospitals, we give health education, which is more of a health talk. And also in the hospital, we provide services for prevention. Even screening is a way of preventing and promoting health. So when you do the screening services in the hospital, and you provide what is expected after screening, have a health talk, you advise the patient accordingly, you are able to actually promote health. So health promotion is in different ways. We can also do encourage on nutrition. We are promoting health and the antenatal care for the pregnant ones, that is promoting health, and so many other activities that we do within the hospitals. Let's look at the management of the hospital. In every organization, in every institution, we have to have a management section. Nothing can operate and nothing can function well without being managed. So even the hospital has the aspect of management. So hospital management involves overseeing all aspects of a healthcare facility to ensure efficient operation, quality patient care, and compliance with regulations. So in management of the hospital, we look at people who help us or a team of different individuals in different qualifications, and they really help us to oversee all the activities and services that are offered in our hospital, and they ensure that there is efficient operation of all the services and processes in the hospital, and they ensure there is quality of care, and we also comply with the regulations, because without regulations that means we shall go off the objectives, as we talked about objectives of the hospital. So different hospitals have their different objectives. Some of them derive from their missions and they look at their vision, but without compliance to the regulations, then we may not be able to meet them. So the hospital management is basically looking at those different um, aspects that I've already tried to elaborate. Then governing body, there should be a governing body for the hospital just to govern what is taking place in the hospital, or to control. There are different words that can mean what the governing body is actually expected to do. And then hospital committee, different hospitals have hospital committees, and those committees actually help in the management of different activities and different services that are needed in the hospital. The medical director actually is the leader of the hospital, and his work is actually to direct some of the activities that are run in the hospital, and he's in charge and he's the accounting officer of the hospital. Medical superintendent, the medical director and the medical superintendent are the leaders, but these are in different levels of the hospital. The medical director can be leading a higher level of the hospital, and the medical superintendent can be leading a lower level of the hospital. But before the medical director title came in, they were mostly using the medical superintendent, which is equally the same. They are the leaders of the hospitals. Then hospital administrator, the administrator, they basically do the administration work in the hospital. They have to know how the resources are being utilized. They have to control things like the use of the cars. They have to control things like the fuel. They have to control this other administrative a bit of the management. That's where the hospital administrators actually help us. Then the nursing superintendent is the leader of the nurses, and we have different cadres of different medical professionals. So for the case of the nursing cadre or the nursing fraternity, it's the nursing superintendent who is in charge of the nurses. Department heads, as I mentioned about the different departments, I mean the different levels of the hospital, it depends on the scope of services they offer. It depends on the level of the hospital. That's where we can also be able to get the department heads. And the departmental heads depends on the number of departments that the hospital has. So I can give an example of surgical department. The person who will lead the surgical department is basically the surgeon, someone who is going to specialize in surgery. Then when you look at the pediatric department, that one is someone who has specialized in pediatrics and heads the pediatric department. So we have different departments depending on the services that we offer to our clients in our different levels of the hospitals. What are the key responsibilities of the managers? So the key responsibilities of management is the strategic planning. They have to plan accordingly. They have to look at priorities and the strategies in their planning to see that they meet what is really very needful, and they're able to address them according to uh, their capacity and ability of the hospital. Then financial management, they also manage finances, and the hospitals we have accountants, and they are also in different levels. Have the senior accountant and then the accountant. So they help us in managing finance, how the money comes in, the budgeting, and how it is being spent, the costs of what they buy in relation to the needs of the hospital. Then quality assurance, yeah, sorry, they have to ensure quality of services, what they really need to provide to meet their patients' needs and to be able to satisfy their patients. Human resource management is also one of their key responsibilities. The managers have to look at management of human resource, and in human resource, there are so many things that happen. They have to recruit skilled staff. They have to make sure that there is motivation of their skilled staff. They have to make sure that they are the ones who advertise. They look at so many things that actually relating with the staffing. They also have to look at development of their staff. I want to say that anything concerning the staff of the hospital, the management has to look at it, and it is basically in relation to human resource management. And this one is mostly handled with the human resource office. Strategic planning. As already mentioned, I tried to explain in the previous slide, but here it's more elaborated, and I want to further it in a way that uh, strategic planning in hospital management involves setting long-term goals. So we strategize in a way that we look at the future. So when you look at the future, that means we have to set goals that are long term, and we have to develop strategies on how we are able to achieve those goals that we have actually set, and aligning resources to achieve the hospital's mission and vision. So as I mentioned about the objectives, and I said some of the objectives the hospitals get from their missions and visions. So when you look at this strategic planning, we strategize to see that every plan that we plan is in relation to uh, how we are able to achieve, and we have to look at the resources that we have, and we have to focus on our mission and vision. So what can be the components in strategic planning? The mission and the vision is very important. So when you look at the mission, you can be able to derive most of our objectives from our mission. And also we have to look at the vision statement, and that will be able to guide and direct us in our planning. Then not forgetting the SWOT analysis. I believe we all understand what SWOT is. So when you're planning, you have to look at the strength of the hospital or your organization. You have to look at the weaknesses that you see within you, and you have to look at opportunities, what can help you, and what you think you can use as an opportunity to achieve something. And you look at also the threats. What could be the threats to the hospital? What could be the threats to the organization? And how can you plan to actually address them in your strategic planning? So the SWOT analysis is very important. You should analyze the strength, analyze the weaknesses, analyze the opportunities, and also analyze the threats that you're trying to see within the organization. So that when you're planning, you have to strategize and look at the resources you have and focusing on your mission and vision. Then goal setting should be also smart, whereby you should be specific, and your goals should be measurable. You should not just plan for what you know you cannot measure, and they say what you don't know you cannot measure, and what you can't measure you cannot be able to achieve it. So your goals as you set them should be smart and can also be according to the time. So there should be time bound, whereby you should know by around this time we should be able to achieve this. So your goal setting should be a smart one, and your goals should be smart so that you can be able to attain them. Otherwise, you just plan and you end up not achieving anything if they are not smart. In financial management in hospitals includes budgeting, as I told you already, budgeting, revenue management, because even in the hospitals there are charges and that can be there. Revenue management is very important because if you don't pay revenue, then some of the services can be actually hindered, and yet you need them to provide adequate care to your patient and quality care. Let me give an example of water. We need to pay water, and we need to pay electricity. So those are some kinds of charges that we have to actually look at, and there are other revenues more than even water and electricity. So when we don't pay some of these revenues, they end up affecting us in our hospitals. Then the cost control is also very important, and we really look at it within the financial management and then financial reporting to ensure the hospital's financial health. So as you use this money in the hospitals, we really have to actually give out the accounts on how we are spending them and how we are receiving whatever we receive, uh, what we have budgeted. Are we really getting using our budget, or we are going beyond the budget? And if we are going beyond the budget, how are we able to to see that we address other issues that might have been in the budget and we have not met, and they are very important. So budgeting is very important so that you don't go beyond the limits. And when you do that, then you're going to affect and paralyze other activities. So financial management is very important in our hospitals, so that you can be able to make continuity of patient care, because when we affect our finances, we can fail to actually provide some of the items that we need for providing the health care. So when you look at this, you realize there are different activities, and I've already explained to you about budget preparation. They have to sit as a management um, and plan and prepare their budget. And when they prepare the budget, they have to look at how much they have, what are the sources of the monies that they get, the flow of money in and out of the hospital. Then revenue cycle management, that one also is very important and talked about revenue. So they have to look at that aspect also, because some of these things are necessary, so you can't avoid revenue. And then expense monitoring, how are you spending? And are you spending them in things that are really so vital for the hospital, or you're just wasting money because you want to get something to benefit you, and you don't know that you're depriving the innocent people from actually getting what is expected of them. So expense monitoring is very important for you to know how are you spending the money and what are you spending it for. Is it necessary for you to spend it, so that you can be able to address before you go out of the right path on your money or financial management. Then quality assurance measures are actually crucial to maintaining high standards of patient care, safety, and satisfaction. So when you look at quality, every one of us has a different definition, version to quality. The way I may understand quality is different from the way you understand quality. But quality is something of value. If it is not something of value, then it is not of quality. So quality assurance basically looks at the standards of our patient care. Is it of good standard? Are we providing safety in the services we are providing to our patients? Are they safe? And as we provide those services, are our patients actually satisfied with what we are offering to them? So within the quality assurance, we have quality improvement initiatives, whereby we have to do all what we think can improve the quality that we provide to our patients. So quality improvement initiative is very important in the quality assurance. Patient safety protocols, we have different protocols that actually guide us in different services that we offer to our patients, different procedures that we actually offer to our patients. So these protocols actually help us to make that our patients are safe in whatever we do to them. Accreditation and compliance. Accreditation, this looks at different services that we offer to our patients, and every hospital has to be accredited to offer those services. When they are not accredited to offer those services, then it loses trust from the community, and many people may not actually trust us. So we have to look at the accreditation, and we have to comply with so many things that we may be able to actually achieve the quality of care. Human resources management. Human resources management, I think I hinted on it before, and managing hospital staff is very important, and I talked about basically the staffing. I talked about the training, the development. I talked about uh, recruitment, which is already here. So staff recruitment and retention is very important. Staff turnover is always very bad, because when staffs keep coming in and out, we may be able so to, we may end up actually affecting the services that we offer. So even in the recruitment of the staffs, we have to actually look at the skilled staff. We have to look at our finances, how much we have to help us actually have the number of the skilled staff that we need. We have to look at the vacancies, because we can't just bring people from nowhere and say we are employing you when you don't have the vacancies of those different qualifications. So staff recruitment and retention is very key in human resource management. Training and development, we have to train our staff so that they can have they can improve on their skills, and development is very good so that we can be able to retain them. Because I don't think there is anyone who can accept to stay in an organization if for him is not developing. And you find this happening in different organizations. The bosses do not want their subordinates to develop, and they don't allow them even to go for studies. So they keep them within the same position, just because they feel maybe if this one goes back for a training, if this one develops himself, might be maybe promoted, and I'm left behind and all that, or he can be better than me, and it's really very bad. So we should motivate our staff so that we can be able to improve on the services that they provide, because when everyone is happy, then also service provision will be actually of quality. The relationship in the organization will be so good, and that one will be actually a way in which we can improve on the health care that we provide to our patients. And performance evaluations is very key. We need to know how our staffs are performing, because if we don't know how they are performing, then we shall also not be able to actually measure the output. We shall not be able to know the quality of care that they provide to our patients, and we may not be able to know what kind of services do they really give to our patients. And one of the tools that is being used in most of the organizations to address this performance evaluation is the appraisal forms. So most organizations use the appraisal forms, where we have the indicators, we have the output, and we look at how much they have been able to provide in relation to the different objectives that they may have actually planned for that specific period of time. It can be maybe 6 month period, it can be for 1 year. So at the end of it, you have to evaluate how they have performed, and that is one way of managing our human resource. So hospital leadership is very key. When you look at management, we also talk about leadership. So hospital management involves a team of leaders, and depending on the level of the hospitals, and depending on the founder of the hospital or the ownership of the hospital. So the chief executive officer, the CEO, this is the highest officer who is in charge with the management of an organization. And this is especially in private organizations. We realize that they use this title so much, the CEO, and also in some non-profit institutions, they can use it. Then some few government organizations, they can also be using this title as a chief executive officer. So he's actually responsible for whatever is happening in the hospital, and he's responsible of implementing all the existing plans of the hospital. He is able also to help us in developing the policies in which the hospital is supposed to operate, and also is able to provide for us the accountability of the company or the institution. So the chief executive officer is a very big person who is actually to take lead and account for for the services that are in an institution. Then we have the chief medical officer. The chief medical officer can be also like a hospital director, and this one's actually help us in managing different activities also in the hospital. Having mentioned leadership depends on the type of the organization. We have private organizations, we have government organizations, we have Christian founded organizations or hospitals or institutions in relation to health, and different ownership of the hospitals always give different titles on the different staffs that they have or the leadership they have in their hospital. So the chief nursing officer, we mentioned that the nursing superintendent is the same as the leader of the nursing, and the chief nursing officer is still the same word, though it is having the different wordings. I can say chief nursing officer, I can also say nursing superintendent, I can say senior principal nursing officer. They do the same thing. And then the chief financial officer, the CFO, these ones are basically managing finance, and they look at the flow, the cash flow of the organization. Some of them are in the districts and they sit on the financial section of the district or of the hospital, but this is just a title. Then chief operating officer can also be called the chief operations officer. It is the same thing, COO. And this chief operations officer is an executive person in whom he actually reports directly to the chief executive officer. So the chief operations officer is actually responsible for all the processes and the operations of the hospital, and he manages the hospital when the CEO is not around. He is the one responsible and is actually next to the CEO. So he reports directly to the CEO and he acts like on behalf of the CEO in case of the CEO's absentia. So the chief operations officer is also a big person in an organization or an institution, and this basically looks at the different leaderships in the hospital, and these titles depend on the founders of the hospitals and where they are located. So they have different names but meaning the different, meaning the same either person or meaning the same position. Hospital governance. A hospital governance is concerned with decision making, policy development, and regulatory compliance. So regulatory compliance is just like regulations, complying to the regulations. And in every organization, every institution, there should be something governing it. And if it is not governed, then there will be no compliance to some of the rules that are put in place. So for the hospital governance, there should be a governing board, which is the top, and they should be able to have the hospital policies and bylaws, and that is the responsibility of the hospital governance, whereby the governing board is able to develop the hospital policies and bylaws. So it's also very important in managing the hospital. So in relation to the governing board, there should be trustees, leaders, and experts that form the governing board. So without the governing board, then most of the activities may not be able to be run. And the trustees can be used in Christian organizations like the church founded hospitals. When you look at the Catholic religion, most of them they have the trustees, and those are just governing boards that help us to manage the hospitals. And leaders, experts are those who are really responsible for different sections where there is need of expertise. So they should also be incorporated in the composition of the governing board. What could be the roles of the governing board? The governing board has a very big role to play in the hospital management, and without the governing board, some of the things, activities, processes happening in the hospital may not be actually functioning without the governing board. So some of the primary responsibilities is strategic decision making, as talked about strategic planning. So there should be also decision making on those strategies, and it is more of the governing board making those decisions. Then oversight of executive leadership. So the governing board is responsible of actually supervising the CEO, and they can be also overseeing what the CEO is doing, and they can appoint a CEO, and they can also sanction the CEO. So the governing board has a big role to play in the hospitals as an oversight of the executive leadership. Then ensuring compliance with laws and regulations. As having mentioned about regulations, without regulations, most of the activities will not be of quality. The staffs will not be doing the right things. So in every institution, there should be laws and regulations. So the governing board makes sure that these laws and these regulations are complied with by the organization. Then decision making, examples of them are approving the budgets, major capital expenditures, and those are big kind of spendings in the organization, and it is led by the governing body. Then leadership appointments, they appoint leaders in the governing board. They appoint leaders, as I mentioned, the CEO, they are the very ones who appoint them. So the governing board has a big hand in a hospital. Policy development and approval of hospital policies is their role. They are able to develop different policies, and they are also able to approve them. And they will approve them or develop them in relation to their mission, vision, and objectives that they need to meet as an organization or a hospital. Involvement of the governing board. So, in all aspects of life within the organization or the hospital, the governing board is very, very important. So looking at the health of the patients, looking at the staffing, looking at the services offered, looking at the structures, looking at financial spendings and all that, the governing board is actually very key. So ensuring the policies align with hospital mission and regulations, I've already talked about it. So all the policies that they bring out or they develop, they have to make sure that they align with their mission and the regulations so that they are able to meet their goals and objectives. Regulatory compliance, I've mentioned about it already. Crucial role of the governance, they have crucial roles to play. Alignment with health care regulations, and when they see that, let me talk about the mitigation of legal and financial risks. They try to mitigate. Mitigating is like avoiding. So they try to avoid some of the legal issues, and the legal issues can be maybe suing the hospital when some problem happens, or having a challenge which may lead to court. So those are kind of legal issues that they try to avoid. Then financial risks, if there is maybe some kind of finances that they think if we spend this, it may give us a crisis. So that's why they are very important in the organization. They try to support in mitigating the legal issues and also financial risks that may end up affecting and paralyzing the services of the hospital. Hospital policies and bylaws, defining hospital operations and processes is their role, and then guidelines for governance and staff. So they bring in guidelines for the governance and the staff. So there should be guidelines that they follow, and this is the responsibility of the governing board. Bylaws set the framework for board operations. So themselves, as the governing board, they try to bring in some framework to help them in the operations of different activities that they're supposed to play in the hospital. So they really have a very big role to play in relation of the guidelines, policies, regulations, processes, procedures. So when you look at this, you see they also help in standardizing the processes and practices within the hospital. So procedures are very, very important, and practices are very important. So when they look at this, they feel it should be of a standard. So they try to standardize different procedures and different practices of the hospital, ensuring consistency in care. Consistency in care is very key. If there is no consistency in care, that means you are failing. So the governing board has to make sure that services are offered, the care to the patient is consistent, so that patients can be able to actually access what they need. Then providing legal and ethical framework. This is very important. Ethics is very important. Professional ethics and code of conduct are very important. They helped actually to guide us. They help us to do the right things, and they regulate us from doing what is not right. So the governing board has that role to play, and they bring in relation to policies and bylaws. Monitoring and updates, they help to monitor most of our policies, how we are adapting to them, whether we are actually abiding and complying. So also in one way or the other, they help to revise those policies and they help to review them. So when they revise and review them, there are those that they think maybe they may be so harsh, or the staffs are not able to follow them, and they see how to amend them so that they can be able to be followed by every staff. Or else when they review and see that they are not really in line with their mission and vision, then they can revise and see how to actually redevelop them so that they can be able to actually meet what their expectation is as an organization. Hospital departments, there are different departments in the hospital, and these departments depend on the services that are offered and the specialties of the different skilled staffs in the hospital. Clinical departments are very many. Clinical means the clinical staff in a way that they provide the clinical services. So there are different departments in relation to the clinical department. As I mentioned previously, we have the pediatric department, we have the surgical department, we have the gynecological department, we have the medical department, we have different departments, and this is according to the services offered. Then administrative departments, administrative, we have already talked about management, and those are the same people offer for us the administrative aspect bit of it in our hospitals. So there's that also actually as a department in the hospital. Support services, when you look at the support services, these are people who help us. When you look at the cleaners, they support other services in the hospital because we can't work in a dirty environment. We can't put our patients in a dirty ward. So the support services are very important. And one time when I was doing my postgraduate, it was very interesting that one of the lecturers, professor, said every person in his capacity in a healthcare service organization or institution is very, very vital. And he gave an example that even a mortuary attendant is very important, because if you have people who are dying in your ward and there is nowhere to take them, you, the health worker, who is either a doctor or a nurse, cannot stand to work in an environment where there are dead bodies. So everyone is very important. These support services are very necessary, that we need them in our hospitals. auxiliary services or ancillary services, not auxiliary but ancillary. Ancillary services are very key, and these are supportive or diagnostic measures that supplement and support a primary physician, nurse, or other healthcare provider in treating a patient, for example, lab tests, ultrasound, pharmacies, etc. So, when you're providing service, you cannot say that you can be able to diagnose alone. You can be able to go and work in the lab. Then after working in the lab, again you go and treat the patients. So we need also this. We need this ancillary services so that we can be able to actually provide the services that we need to our patients. So in that way, I want to say that ancillary services are very key and very important for us to have in our hospitals so that we can be able to meet actually the needs of our clients. So the example I've given as lab, and then pharmacy and many others are very important. Ultrasound are very important. So this looks mostly on the diagnostic aspect that can help us to identify actually the causes of the diseases, and also identify the actual condition of our patients, and we are able to address them and meet the needs of our clients. So these are very vital. Hospital operations, this is when you hear the word operations, I think all of us can be able to understand what it means. So this is the day-to-day operations of a hospital, including patient admissions, care, delivery, and discharge processes, patient flow, and bed management. So when the patient enters in the hospital, you have to see how this patient is received. When a patient goes to the ward, what happens? And if a patient is admitted, what happens? And when the patient is discharged, what happens? So that is very important for us to actually look at the hospital operations, and it can help us even to align most of our patients in relation to the services that we offer and in relation to the flow of our services and the flow of patients in different departments in the hospital. So hospital operations is very, very important, because if we don't have this, then the hospital can also not be able to operate. um, Healthcare information system. The health information system for the hospital mostly relies in the healthcare information systems for electronic health records. So when you look at this, this is more in relation to the data of the patients. In most cases, some hospitals have gone as far as billing the patients electronically, collecting their data and analyzing it electronically, which is very, very important. So it's designed to manage healthcare data through collecting, storage, managing, and transmitting a patient's electronic medical records. So I want to give an example of a hospital where I took my dad, and everything was electronic. Going to see the doctor, you just hear the name. When you enter in the room, the doctor talks to you and is typing in the computer. After typing the computer, it tells you go to the lab. When you reach to the lab, you find every kind of information has been sent there, the investigations that are needed, your complaints and all that. They only remove the sample and they tell you go to the reception, wait from there. When you're there, you hear your name, they're calling you to either the pharmacy or to the treatment room or back to the doctor. So all the data of the patient is actually collected within the electronic system, and all your records are kept there, and they are able to retrieve it at any time. and they are able to know who is the patient. So this healthcare information systems is very good. We are able to actually capture the data of our patients. We are able to analyze even the data of our patients, and we are able to store them, and we are able even to transmit them in the management of our patients. And then data security and privacy is guaranteed through electronic system, whereby we have the codes and we have passwords, whereby this information is actually uh, private, and it is very secure, and we cannot actually see that some other people can access this data. So you realize healthcare information systems is very important in our hospitals, and we are able to collect this if we use electronic kind of um, systems. So the information generated is for the benefit of the public health, since it can be used by the clinicians to manage the patient. So it's very important for every hospital to have these healthcare information systems. Regulatory compliance, we have it. We are actually supposed to comply with the regulations that are really put in place in every hospital. And when you comply, then we are able to meet the needs of our patients. So regulatory compliance in healthcare is designed to ensure that health organizations and professionals adhere to laws, regulations, and standards that govern the delivery of healthcare services, and compliance is actually essential for protecting patients' rights and ensuring the delivery of healthcare services. And compliance is actually essential for protecting patients' rights and maintaining the integrity of regulatory compliance is. So when you comply on those different regulations in relation to those different aspects that we have mentioned, that we shall be able to actually protect us, our patients, and we shall be able to ensure the safety of our patients. We shall be able to ensure that we provide integrity to our patients, and also the data that we have, because when we comply with the regulations, we shall get the right data in relation to our patients and the healthcare services that we offer, and that data can be transmitted to be used in the hospital. It can help us in decision making, it can help us in budgeting, it can help us to also know which conditions are actually of great importance in our hospital. And also this very data can help us to actually improve on our research, because as we mentioned in the definition, a hospital has actually to advance in research, and research is actually the basis of the healthcare systems, if I can mention. Without research, then we shall be working blindly in health. Performance metrics. Hospital management relies on key performance indicators to assess hospital performance and identify areas for improvement. So in every organization, every institution, we have to actually have our performance indicators. And when you have our performance indicators, we can be able to assess how we are performing and what we need to improve, and some of the examples of the KPIs, patient satisfaction scores. You can decide to rate the score of your patient satisfaction, and you are able to tell whether you're providing services that are of quality or not. So sometimes different hospitals have different ways in which they measure actually the patient satisfaction. Some of them have like some of them have like where the boxes where they put some comments, and they just put in the corners and patients write something and drop there. Some of them go and meet the community and discuss, and some communities are very open, they speak out. So you can be able to rate your patient satisfaction in different ways. And when you rate it, you're able to score how much are your patients satisfied, what do you need to improve, and what do you need to actually keep up. Then the length of stay also can help us as an indicator to rate our performance. If you admit patients and they stay for a longest period of time in your hospital, then you should assess why. Is it that you're not offering quality services? Is it that you don't have enough either drugs? Are you not able to diagnose? Where is the issue? And now research can come in there. So the length of stay can help you to assess actually how you are performing in your hospital. The longest time they spend can also tell you a lot of things that you may need to improve as a hospital. The shortest period of time also can be able to tell you, are you just admitting patients who are not very ill? And if you admit the ones who are very ill, how long are they taking to stay in your facility and they improve and they are discharged? Then readmission rates, if you have very many patients coming back, you treat today, you discharge after 2 days, the patient is coming back, and not only one but several of them. Then there you have also to see how you rate yourself. Are you doing the right management? Are you providing the right services? Are you meeting really the conditions of these patients and managing them well? Or your diagnostic aspect bit of it is not right? What do you need to improve in your laboratory? Or you're missing out the diagnosis of your patients? What could be the issue? So you can be able to rate your performance in that way. So those are some of the performance indicators that can help you in your performance metrics. Continuous improvement is very key. Lean Six Sigma principles is one of the primary things that we should look at. So the primary aim of the lean method is basically to reduce waste. So when you look at this method and you follow these principles of this Lean Six Sigma, it can help you to reduce the wastage of resources in your hospital. And its goal is also basically to reduce the variation for optimal quality control. So you have to control quality of whatever you're doing and can also help you to reduce the wastage. So it looks at defining what are you aiming at, what are you looking at, then measuring how much you are able to, and also analyzing the bit aspect of it and how are you improving and controlling it. So when you look at the Lean Six Sigma principle, it can help you in so many things in your hospital, and you can be able to address most of the aspects in service provision and addressing the quality of care that you're providing to your clients. So quality improvement teams, what do we look at this? To continue improvement of services, you need to have a quality improvement team in your hospital. And this team is basically like a group of people and they have multiple skills and they are able to actually take the responsibility of improving processes or services within the hospital. So a team can be taking lead to improve the quality improvement activities in your hospital. So this can be done if you have different people with different skills and they form just like a group or a committee, and their aim is basically to look at how they are able to improve the quality of services that are offered. And by them doing this, there will be continuous improvement in your hospital until one day you reach to that standard that is expected. So we need these quality improvement teams in our various hospitals, looking at the standards and the qualities of services to satisfy the needs of our patients. Crisis management, how do we manage crisis? Crisis is not only in the hospital, crises are in different other institutions besides the hospital. Crisis can be also in our families. So how can you manage crisis? So crisis management is very key because if there is a lot of crises or so many things, including the skilled staff, resources, like drugs and all that, then you are not able to actually address so many things and so many problems in our hospitals. So hospitals must have crisis management plans in place to address emergencies, disasters, and unexpected events. So, in even a country like there are outbreaks of different diseases. So, the Ministry of Health and other different ministries have to plan to manage crisis. Look at COVID. When COVID came in, people were not prepared, but in one way or the other, they had to plan on how to manage it. So, in a hospital, there should be a crisis management plan in a way that they have to look at in case something breaks out now, how are we going to manage? There are so many emergencies, and those emergencies can be costing life. And if you don't plan, you may end up losing so many people. Disasters and unexpected events like COVID when it came in. So there should be crisis management in the hospitals preparing for such kind of events. Emergency response protocols should be there, whereby they should be able to know in case an emergency occurs, how are we going to respond? So those protocols should be in place in all hospitals so that they can be able to handle those emergencies. Then disaster preparedness is very key. Disasters are in different ways. Disasters can be maybe even floods. Disasters can be hunger. But when we are looking at disasters in the hospitals, we are basically looking at disasters happening in a way that we are not able to actually meet the needs of our people, just because maybe we don't have the ability to provide in a way that we may not have planned very well strategically, as we already talked about strategic planning. So crisis management is very, very key in our hospitals so that we can be able to provide continuity of services. So, as we talked about hospitals, we also talked about different levels of hospitals, and it can be different classifications. Levels can be in classifications, and they can be in relation to their scope of service provision. It can be according to the specialities that are within that hospital. So for these classifications of the hospital, we are looking at based on the length of stay, short term or long term. And we talked about long term and short term of patients. Then, based on clinical focus, general and specialized, are you only looking at the general patients, all of them, or the hospital is focused on specialized kind of services? So they can also classify them in that way. Then, based on ownership or control, it can be either public hospital, it can be a voluntary hospital, it can be private or a corporate hospital. So the classifications vary on the ownership of the hospital. And as we talked about the ownership of the hospital, we mentioned about the CEO being the lead in case of mostly the private founded facilities, and the public can be government owned founded hospitals. Voluntary can be non-for-profit, private but not for profit, and they can be Christian founded organizations, and private can be personal. There are those people who have decided, like me, I want to open a hospital, and they can say, this is my hospital. Or any other organization can open a hospital, but is private and they pay for it. You don't just go and get a service like for the government, but you have to pay for it. Then corporate can be a group of people who are really well off and they have their money, and they can say, let's open a hospital in a certain class. Then based on objectives, some hospitals have their own objectives in relation to their objectives, and we said objectives can be classified in relation to their objectives, and we said objectives can be derived from their missions. So, basing on the objectives, you can look at the teaching hospitals. There are some hospitals that are basically developed or constructed in relation to teaching the students. So those can be classified as teaching hospitals. Then district hospitals, those ones are basically the big hospitals in the districts. Then primary health care, taluk, I'm not sure of that. And then primary health center, those ones can be health center too for the ones that are within the parishes. Because we have a parish, we have a sub-county that is for Uganda. And those primary health centers are primary health care that they need. Based on management, when talked about management, management can be government managing its hospitals, which are public. It can be the state, local, autonomous, private, and voluntary. So for the case of voluntary, those ones can be private, not for profit. And those ones can also be more of the church or a Christian founded and based on the systems. So when you look at hospitals, how they are classified, it mostly looks at um, how long the patient stay, who has founded it, what kind of services are offered, where is it located, who is managing it, so they can be classified in relation to that. The other one is planning and designing a hospital. So when you want to plan and design a hospital, what do you have to look at? You cannot just come out of nowhere and say, I want a hospital. So there are some other key things that you have to think about before you start saying you want to plan or you want to design a hospital. So when you're planning for a hospital and designing a hospital, this is what you're supposed to focus on. Identify available finances because since we have a number of services, we need human resource, we need drugs, we need equipment, we need structure. So you have to identify where you are going to get your finance to help you actually install and avail all that you need as a hospital to operate. Then choose the hospital's location. Where do you want to put it? And when you're choosing the hospital location, you should be able to also know the needs of the community and you should be able to know is that the service you're going to offer really going to address the people living in that place where you're going to locate the hospital. So you don't just put it anyhow, anywhere, but you have to think about where you're locating, what are you aiming at, what are your objectives, are they going to meet the needs of people? Are they able to actually be are being provided within that locality where you're going to locate it? Then conduct a needs assessment. A needs assessment is, as I've mentioned, are you going to meet the needs of those people? So when you conduct a needs assessment, you're going to identify the needs of the people whom you're going to offer the services. Is the service you're going to offer in your hospital the need of that community or the need of that society, or you're going to offer a service that is not actually their need? So the needs assessment is very important for you to actually identify the needs of your community so that you can be able to provide those services in relation to their needs and you'll be able to address actually the problems of that community. You define services to be offered. So as you do the needs assessment, you can be able to define the services that you need to actually offer and you're able to afford them depending on the availability of the finances. Then you can be able to prepare a design of what kind of hospital, how do you want it to look like, what do you need to put in place, and where should it be. If it is like OPD, which side, if you're putting a maternity section, where is it going to be? If it's pediatric, how are we going to make it? How does it really, how do you want it to look like? And all that, that is preparing a design. So when you prepare that design, then you can begin the construction. And when you're constructing, you should be considering also what materials you're going to use, what kind of colors if you're to paint it, and all that, so that you can be able actually to attract the people whom you are going to manage. Because also our structures alone can either help our patients to cure or not. Because someone can just come look at the structure, look at the arrangement of the hospital, and it's like, wow. And That alone can bring an impression and satisfy them. Then hire personnel and plan the training. So you have to hire your personnel and train them. But when you're hiring them, make sure that they are skilled, depending on the services that you're going to offer. So they should be skilled to offer those services, and you should train them on what you need them to do. Because if you don't get the skilled ones and you don't train them to do what you expect them to do, then you're going to miss out in the human resource aspect of it and the skills aspect. Procure equipment and materials. You're going to procure equipments and the materials you're going to use, because if you don't have equipments, then the services cannot be offered. So the equipments you're going to procure should be the equipments to offer actually the services that you're intending to offer in your hospital, and the materials that you need, because the equipments may need other materials that are really necessary for the running of those equipments. Without the materials needed or without other things that are part of the equipments, then the equipments may not be able to operate and you'll not be able to do what you need to actually provide the care. Commission the hospital. After you procure the equipments, you have all the materials, all the necessities, all the drugs, all the sundries, um, every kind of bit of it that you need actually to operate uh, actually is got, then you can be able to commission the hospital. And commissioning the hospital is basically opening it to the public, letting everyone know that this is actually a hospital, this is our intention, these are the services that we offer, we are able to do this and that. And by that, you are able to go and successfully you have an operational hospital. So I want to thank all of you for having attended the lecture. Um, I'm so